Fleming, and I've had a lot of questions as a paramedic about what people should carry for their blowout kits or a IFAK, individual first aid kit. And this is mine here. This is not the answer for everybody, so you may have people who are more knowledgeable that can give you that information. But for me and my level of training, this is what I carry to the range or anything like that. I try to carry a rip-off design for a war belt. Make sure you get good quality, good stitching. But really what's inside is going to be more important than what's on the outside. What I carry is, I'll show you these pockets here. I carry all these extra gloves. This is a way to save money here if you don't have money for high-end chest seals. This is Curad petroleum dressings. They're good for chest seals. They've been used for chest seals for years. I carry at least a couple of those. I carry non-adherent abdominal pads. This is a 5x9. I carry Curlex, is what I call Curlex. Roll gauze. I carry a Hilo brand chest seal. This is very sticky, you can cut it up. I carry combat gauze. This has a hemostatic agent that will help you in stopping bleeding when you pack wounds. Very essential. I recommend getting that. Also what I carry is I carry a triangular bandage. Make sure you get the one that's made from cloth. Don't get the paper-based ones, they tear. This can be used to hold an arm up with a shoulder injury. It can be used for an alternate tourniquet. I carry Gorilla Tape that's been dog-eared. Believe me, if you have to do a chest seal or anything like that with trauma, you want these dog-eared because your hands will be bloody. And I recommend 5 or 6 of those, and these will be anywhere from 6 to 8 inches long. Carry you a good quality tourniquet. I have a cat tourniquet. It's North American Rescue. Do not go for the cheap ones for your kit, please. Cheap ones are for practice. Good ones are for you. I carry this trauma pack. You can get these at Academy Sports, Walmart, all kinds of places. What they have a hemostatic agent in there, some more gauze, a triangular bandage, things like that. And also they're waterproof. I like that. If you are in a maritime environment, lake, river, things like that, you may want to put these things in Ziploc bags. More gauze, some butterfly tape, just for boo-boos. And I'm trained to use oral airways. This is a BLS skill. Get the training if you want to do that. I carry a pair of shears that I can see if I drop them in the dark. I carry a decompression needles, 14 gauge and larger. This is for a ALS skill. You need to get trained because this is fraught with danger if you use this by yourself and you're not trained. It's for potential pneumothorax. And I also carry a space blanket because if I'm going to a traumatic event and there's multiple casualties, as a paramedic, if I pull up and I see somebody that's being this is on their person, that somebody's being treated for shock, I'm going that way first. And again, some more gauze for cheap chest seals and more gauze. And that's it for my kit. Now you can add and subtract whatever you need from this kit. But I recommend, the most important thing is, if you don't know how to use these things, you need to get the training to use them. Tools without the knowledge are almost worthless. Thank you, and that's my blowout kit.